Have you ever walked into your living room and suddenly forgotten why you went there? Or maybe you were telling a story only to blank out halfway, unable to recall a familiar name? If you're over 60, these moments might feel frustrating or even a little scary. And most people brush them off, thinking, "Oh, it's just normal aging." But what if I told you these little lapses might actually be your brain whispering something important, that it's missing something, that it's hungry for the right nutrients? Maybe it's vitamin B12. Maybe it's a healthy fat you stopped eating years ago. Or maybe it's something you've never even thought about. Today, we're going to uncover the 6 key nutrients that science shows can protect your memory and, in one case, even reverse early signs of memory loss. But before we get to that, let me ask you, have you ever worried that your memory is slipping faster than it should? Let me know in the comments. I read every one. Hi, I'm Dr. Ethan Wells, and on this channel I share real science-based ways to protect your health after 60 so you can live with clarity, strength, and independence every single day. If you've ever felt like your mind isn't as sharp as it used to be, if you're misplacing things more often, forgetting words in conversation, or just not feeling as quick, you're not alone. Millions of people over 60 feel exactly the same. But here's what most don't realize. Your brain needs specific nutrients to stay sharp. And as we age, we often stop absorbing those nutrients the way we used to, leading to silent deficiencies that can quietly chip away at memory. In today's video, I'll walk you through 6 of the most important nutrients your brain depends on. You'll learn where to find them in everyday foods, what signs might mean you're not getting enough, and the big mistakes to avoid when it comes to supplements. So stick with me, and if you haven't already, make sure to subscribe. Every week, I'm here with practical doctor-backed tips to help you protect your brain and body as you age. And now, let's talk about why this topic matters more than most people think. As we get older, the brain naturally changes. Nerve cells don't talk to each other as quickly. Levels of key brain chemicals like dopamine or acetylcholine start to drop, and tiny gaps in nutrition, built up over years, begin to show up in scary ways. Trouble remembering names, difficulty staying focused, or just a heavy mental fog that never seems to lift. Here's the part that surprises most of my patients. Memory loss isn't always a normal part of aging. Very often it's a symptom, a warning sign that your brain is running low on the nutrients it needs to stay healthy. Let me tell you about Doris, a retired school teacher who came to see me. She was 68, sharp, active, full of life, but something had changed. She couldn't remember simple directions. She would start a sentence, then forget what she was saying. Her daughter noticed it. Her friends noticed it. And worst of all, she noticed it. Doris told me, "I'm afraid I'm losing myself, Dr. Wells. Is this how it begins?" We ran a few simple tests and discovered she had dangerously low levels of vitamin B12 and vitamin D, 2 nutrients directly tied to brain clarity, mood, and memory. We didn't start with pills. We started with small changes. 1 serving of fatty fish a week, a B12-rich breakfast with eggs and fortified cereal, gentle vitamin D supplements. Based on her blood test, 3 months later, she came back and said, "It feels like the fog is lifting. I can follow conversations again. I feel like myself." That's why this video matters. Because memory loss doesn't always mean dementia. Sometimes it means your brain is asking for fuel. So let's take a closer look at what that fuel actually is. 1. Why does vitamin B12 matter so much for your brain after 60? Main benefit: it protects the coating around your nerves so brain signals stay fast and clear. Simple explanation: vitamin B12 helps maintain the myelin sheath, a layer that protects your nerves. When you don't have enough, signals slow down and memory starts to slip. How to get it? You'll find B12-inch eggs, salmon, tuna, dairy, and fortified cereals. But here's the catch. Many older adults don't absorb it well, even if they eat enough. What to do? Ask your doctor to check your B12 levels with a blood test. If it's low, supplements, or in some cases, injections may help. Quick warning: don't take high-dose B12, just in case. Too much isn't helpful either. 2. Is vitamin D just for your bones, or does your brain need it too? Main benefit: vitamin D reduces brain inflammation and supports mood and memory. Simple explanation: low vitamin D levels are linked to cognitive decline and a higher risk of dementia. This vitamin helps regulate immune function and protect neurons. How to get it? Sunlight about 10 to 30 minutes in the morning helps your body make vitamin D. You can also get it from fatty fish like salmon or sardines, egg yolks, and fortified milk. What to do? Get your blood levels checked, especially if you avoid the sun or live in cloudy areas. Supplements can help, but the dose needs to match your lab results. 3. Could omega-3 fats be the most important brain food of all? Main benefit: they build brain cells and help keep memory sharp. Simply explanation: omega-3 second, especially DHA and EPA, are found in high amounts in your brain. They support healthy cell membranes and reduce inflammation. How to get it? Eat fatty fish like mackerel, salmon, or sardines at least twice a week. Don't eat fish? Algae-based omega-3 supplements are a great alternative. Quick tip: if you're on blood thinners, ask your doctor before adding fish oil. Of 4. What does magnesium have to do with brain fog? Main benefit: magnesium helps your brain stay calm, focused, and energized. Simple explanation: magnesium is involved in over 300 reactions in your body, including nerve function. Low levels can cause sleep problems, poor concentration, and anxiety. How to get it? Dark leafy greens, nuts, seeds, and whole grains are rich in magnesium. Try adding spinach to salads or snacking on almonds or pumpkin seeds. What to do? If you struggle with sleep or brain fog, a gentle magnesium supplement at night may help. Check with your doctor first. 5. How does zinc support memory? Main benefit: zinc supports communication between brain cells. Simple explanation: without enough zinc, neurotransmitters struggle to do their job. This slows down memory formation and recall. How to get it? Oysters are the richest source. You'll also find zinc in lentils, chickpeas, and pumpkin seeds. Quick warning: too much zinc can interfere with copper absorption. Don't overdo it. 6. Can vitamins actually protect your brain from damage? Main benefit: yes, especially antioxidants like vitamin E and vitamin C. Simple explanation: your brain is vulnerable to oxidative stress, which damages cells over time. Antioxidants neutralize that damage and keep neurons safe. How to get them? Vitamin A, sunflower seeds, almonds, spinach, vitamin C, oranges, bell peppers, strawberries. What to do? Eat a variety of colorful fruits and vegetables. You'll likely get enough antioxidants without needing high-dose supplements. If you were sitting in my office today, here's exactly what I would tell you. Don't chase every supplement on the internet. Don't try to fix memory loss with a handful of pills. Start simple. Start smart. When I see patients who are worried about memory decline, I always ask 3 questions first. Are you eating real, whole foods, especially leafy greens, nuts, fish, and eggs? Have you had your B12 and vitamin D levels checked in the last year? Are you getting enough rest, water, and movement each day? These basics matter far more than most people think. Let me go back to Doris, the retired teacher I mentioned earlier. What changed her life wasn't a miracle drug. It was breakfast. She switched to fortified whole grain cereal with almond milk and a boiled egg. She walked in the sunlight each morning for 20 minutes. And she added a simple B12 plus D supplement after talking with her primary doctor. Small changes. Daily choices. 3 months later, she felt like her mind had returned. So here's my advice to you. Start with one thing today. Maybe it's adding salmon to your meal this week. Maybe it's calling your doctor to schedule a nutrient check. Maybe it's putting a sticky note on your fridge that says, "Feed your brain, not your fear." Your brain is capable of healing, of bouncing back, of growing no matter your age, but only if you give it the care it deserves. Let's take a moment to bring it all together. Today, we talked about 6 powerful nutrients that can help protect your memory: vitamin B12, vitamin D, omega-3 fatty acids, magnesium, zinc, and antioxidants like vitamin C and E. Each of them plays a different role. Some help your brain cells communicate, some reduce inflammation, and others protect your neurons from damage over time. But they don't work in isolation. They're part of a bigger picture, a brain that's well-fed, well-rested, and well-cared for. So if you're serious about caring for your memory, here's what I suggest. Start small. Pick one thing you can do today. Add spinach to your dinner. Go for a short walk in the sun. Ask your doctor about checking your vitamin levels. And most importantly, don't ignore the early signs, because your memory is worth protecting. If this video helped you, share it with someone you care about. You never know who might be quietly struggling with memory loss right now. And if you haven't already, subscribe and turn on notifications. Every week, I'm here with science-based tips to help you stay strong, sharp, and independent after 60. And if you're wondering what not to eat for memory health, don't miss my next video, 6 foods that may cause memory loss after 60. It's one of the most eye-opening videos I've ever made. I'm Dr. Ethan Wells. Live healthier, live wiser, starting today. I'll see you in the next one.